Good evening, dear viewers, and welcome again to another episode of Health Link, brought to you here in the studios of QTV on Kairaba Avenue by myself, Dr. Abubakar Jah, and Khadija Jallow every Monday evening. Today we have brought in another topic which is really very important, and it stresses the fact that in the medical profession, we do not have only one team of workers. There is a multidisciplinary team where you have doctors. There was a time in the Gambia when you say doctor is just somebody working in the hospital. Anybody working in the hospital is expected to be a doctor. But you have physicians who are called doctors. You have nurses, you have pharmacists, you have laboratory technicians, and many other professionals that are working together to get the patient to be healthy. And today we're lucky to have members from the Pharmaceutical Association who we are going to introduce to you in a minute once we do the greeting. So we welcome you to this program, which I think will be very educative today. mbokk yi ñu ngi leen a nuyuwaati fii nii ci seen programme yi Health Link bi nga xam ne man Dr. Abubakar Jah ak Khadijatu Jallow ñoo leen ko di indil fii nii ci lundi bu nekk di waxtaanee seen wér-gu-yaram fii ci QTV ci Kairaba Avenue. Tey nag ñu ngi fi am ay gan yoo xam ne ñu am solo leen pour waxtaan ak ñoom, waaye balaa leen a wanale ak suñ garab yi gan yi ñu nuyoo ki yéen di leen wan ne rek mbiri faju docteur melut ni ñun suñ faji aada yuñ xam nga xam ne benn sëriñ rek nga dee am nga xam ne moom moo yore yëpp mooy def lépp. ñun si suñ faju ku nekk da nga am xam-xam boo xam ne moom ngay teg ci table bi nga àndaa ñeneen ñoo xam ne ñooy liggéeyaa yow pour ñu mun a toppatoo ki nga xam ne moom moo ut si wér-gu-yaram. ci loolu di nga am ñu ñoo ooyee docteur. xam naa ne nag Gambie fii nii amoon na temps yoo xam ne koo fekk ci lopitaan bi rek yow daal kooku docteur la. docteur kenn la si ñi nga xam ne ñoo leen di liggéey ci lopitaan bi. am na ay nurse ñi nga xam ne ñu ngi liggéey si lopitaan bi, ñoom it dafa am lu ñoo def seen warugal yu ñoo def. docteur bi am na warugalam. am na ku ñoo ooyee pharmaciste nga xam ne moom moo yore mbiri garab yi, moom tamit am na warugalam. am na ñi nga xam ne ñoom ci lab bi la ñoo liggéey, ñoom it am nañ seen warugal. ñëpp ñoo dee di booloo. lii nag dama lim rek ay nit foofu noonu, am na ñu bëree bëri ñoo xam ne ñu ngi ci lim boobu noonu, waaye ñoom ñooy booloo nga xam ne dinañ mun a toppatoo malade bi ba nga xam ne dinañ ko jox li nga xam ne moo gën ci moom. kon nag dina baax tey ñi nga xam ne ñu ngi yore mbiri garab yi ñu ñëw tey ñu waxtaan ak ñoom, waaye ci kanam tuuti dinañ leen wanale ak ñooñu. waaye balaa ñoo def loolu noonu ñu bàyyi Khadijatu mu nuyu suñ mbokk yi wax leen programme bi naka la moo tëddee tey.
Assalamu alaikum baɗi mandinkolu mbalni mbarala allah jati kende a programme o toon dalta kamin kale jantene woten QTV télé bu mbato alnal baɗi ma Khadijatu Jallow anen Dr. Abubakar Jah. mbaɗigol bi fanandu nin kacca ko maya mbale natale nan jang men ka yitandi ko jaral dula fannala lom nyin kacca fanate bay ni ko jaral dula amanke ko ni tata lopitano to docteur o dam male be malaren jararola jaral dula bunda fanutale bake men batin nako amanke kontel lawni mofi jararoti me yalon ko ni tata ko mori kilene be bul wole be jarala adu boro dam ma wole be tamale barobal jaral dula ni tata lopitano ta bunda fanutale bake men ka yitandi ko docteur o bijele noso bijele lab do kula bijele pharmacie do kulal bijele même manke wati wol be la londo ka kafo nyola e ko wolle ka fa ka jeko e sulata jaralo la nyamen anen jata kendi ala nyamen ka dila so wala ya tinna bi dun nellun tan ko mayarin balle fana natale nan jang mel yale be malarin pharmacie ngo bundala wala melka borodi so mbadingol mbal konton na mbal ni mbara programme to.
Thank you very much, Khadijatu. So just like we mentioned, the program today, we have two guests, and in a few minutes I'll just do an introduction, and then we will introduce you with our guests. We will introduce you in a minute with the guest, but what we are talking about is the pharmacy or the pharmacy aspect of treatment, because what happens is that in medical practice, not only one person takes care of everything. So if you have a doctor who, when you go to the doctor, he himself sees you, he himself nurses you, and he himself gives you the medications that you require, then it will be a difficult thing. But if you have people around you who are working together, then it's a complete team, and that is the best way of treating patients. So I'm very honored and very happy today to have members from the Pharmaceutical Society of the Gambia in the name of Sankung Jobate, Dr. Sankung Jobate and Dr. Jundu Jata here with me. I know that in the British system, doctors, physicians are called doctors, pharmacists are called Mr. And in fact, even in the British system, surgeons like myself, I'm no longer a doctor. I'm not supposed to be called a doctor. I'm supposed to be called Mr. Ja, not Dr. Ja. But this is all nomenclature. It doesn't matter that much. So we have here Dr. Jobate and Dr. Jata with us. We are all medical personnel, and they are from the Pharmaceutical Society. And the reason they're here, one of the reasons is that on Monday, on the 25th, which is on Wednesday, is the World Pharmaceutical Day. They will tell us more about it and what the theme for this is today, but we welcome them. Mbokk yi luñ doon wax rek mooy ne tey am nañ fi ñaari gan ñu am solo ñu jógee ci Pharmaceutical Society bu Gambia bi, ñooñi nag ñoom ñoo yore mbiri garab yi, parce que ñun luñ fogoon ci docteur ya ñu bëri sax ba tey loolu lañ dee foog mooy ne maa ngi dem si docteur Ja dina ma may garab. waaw dëgg la docteur Ja dina la gis, dina xam garab yi nga xam ne moom nga soxla, waaye am na ñoo xam ne ñoom ñoo dee di joxe garab yi, am na ñoo xam ne ñoom ñoo gën a xam ci garab yi dara. Su nekkee ne garab yooyu noonu am na yeneen garab yooyu jël, naka nga ko war a jëlee, kañ nga ko war a jël, ak su nekkee ne dina la jox ay problème ak yooyu noonu yëpp ñoom seen xam-xam foofu la gën a màcca. kon docteur Ja nekkul ne moom kenn moo dee liggéey, dafa am ñeneen ñu moo liggéeyal. mu ngi am ay nurse ñu moo liggéeyal, mu ngi am ay pharmacist ñu moo liggéeyal, mu ngi am yeneen technicien yoo xam ne ñu ngi ci lab bi. tey nag ci pharmacie si lañ, so ñu ngi leen a tàttagal fii nii di docteur Jobate ak docteur Jata. kon ñu bàyyi leen ñoom ñaar yëpp ñu nuyoo ci kàllaama angale ba pare tamit nuyoo ci kàllaama mandinka, den ñu continuer programme bi. jërëjëf docteur Jobate, you are welcome to the program. I don't think this is the first time that you've been on this program. Yes,
no,
so you're welcome once again
okay,
to the program.
Thank you. Thank you very much, Dr. Ja, and more importantly, QTV, for giving the Pharmaceutical Society of Gambia the opportunity to come and talk to the public, Gambian people precisely. We have an occasion going on Wednesday, and the theme is World Pharmacy Day. So we are here today to talk about our role. Who is a pharmacist? What do pharmacists do to help the community? Comme Dr. Jaya Funyamin, nata janne bi, QTV, purukana ni mbadi un signol, ani banko dingol basic kacha, ka itandila pharmacist, walo momenka tara pharmacy to eka borodi mon la pour jata kende ya munela do koti. Katu mga juraro le soto menyanta kela on Wednesday arbalong. Juraro nying wolom puru kaitan di mon la pharmacist la doku mumenede. So wale si jambi puru nal si kacha nga fale na doku mumende.
Thank you very much, Dr. Jata.
Thank you very much, Dr. Ja. Thank you, QTV, for giving us this opportunity to be here today. We are members of the Pharmaceutical Society of the Gambia. I work with the Ministry of Health. I've been a pharmacist practicing for about 5 years now. And the reason why we are here today is to tell the Gambian people who we are. People don't know much about pharmacists, what we do as a profession. Generally, even me, myself, before joining this profession, I thought all those people working at the pharmacy are nurses. So this is a concept that is going on among our people. So it is an opportunity for us to come here today and enlighten the Gambian people of what we do as a professional. So mbadin Gambianol mbal konton na bi kajin konton do fata na komiyati na ntol fata jambi ntamun jundu jatalati be do ko Ministry of Health as a pharmacist nata jambi pour que nale kacha katanda la mi yatina nata jang wolon katanda la comme to mu pharmacist solati anu pharmacist fendo min ya lon ko mamira molia mo jama ya lon comme is a profession comme inta fango folo to janin takadunyi professional kono namira ko momo katar pharmacie to mun no solati so wo concept ni nyamera mo jamale wo so wala na bin nata janka tanda la comme jamale pharmacist adu ni mo pharmacist mi e kemu do kulle ke min batine be gembe non la fala wala na nata jambi ala baraka bak.
Thank you very much. I think that's a very good introduction. mbokk yi ñoom ñaar yëpp nuyoo nañ wax nañ ne daal seen taxawaay fii nii tey mooy ne bëgg nañu ñëw waxtaana askan bi ci mbiri ñoom seen liggéey naka la tëddee lan mooy pharmacist parce que ñu bëri ci Gambia xamuñ sax lan mooy pharmacist xamuñ lan mooy nurse lan mooy liggéey nurse lan mooy liggéey pharmacist lan mooy liggéey docteur kon nag ñoom bëgg nañ ñu xam nit yi mun a xam lan mooy liggéeyi pharmacist nga xam ne nit yi suñ ko xamee dinañ gën a mun a am ndimbal ci seen xam-xam dinañ mun a xam daal naka la ñoo jëflante ak ñoom kon loolu noonu lu am solo la dinañ gën a dugg ci waxtaan bi Dr. Jobaate, I want to know then from you maybe if Dr. Jatta has anything to say about it is who is a pharmacist and maybe we put it like that.
Yeah, I would make it very simple. A pharmacist is an individual who is given the responsibility of, one, dispensing medications when the patient comes with a prescription. That's very fundamental. The pharmacist reviews the prescription. So based on his review, if everything, the prescription, the direction, that is how the medication should be taken, the dosage and the frequency, once the pharmacy checks all those things and they are in place, then they would go ahead and then dispense it. But the main role of pharmacists is not dispensing. You need to counsel and or educate the patient. That is the most fundamental thing. You cannot go give prescription to the patient like commonly done in this part of the world to tell them, take one in the morning, evening and night. No, you should tell the individual, why are they taking this medication for? More than likely they came from the doctor, but they don't know exactly because the doctor doesn't have time to spend that, counseling with the patient. So you need to tell the patient what this medication is for, and more importantly, to tell them what to expect, especially with adverse effects. Because when you take medication, it's two things we worry about. Fundamentally, the side effects or adverse effects of the drug is very key. Because once you take it, before you realize any better outcome, is the side effects that you will be presenting. So you tell them in the event that they experience the side effects such as dizziness, diarrhea or whatever, you tell them this is expected from the medicine on the get-go. So once they know that, if they experience it, they would know that the pharmacist had counseled them about it, so it's normal. They would tough it out. And more importantly, to also tell them, what would they benefit from the medication. So once that is done, and also you have to tell them, if it is an antibiotics, it's very important you take it as prescribed. That is, you take it regularly and at the same time. Those are very, very good. So those are the most important thing about the functions of a pharmacy to begin with.
Thank you very much. Maybe in Mandinka, if you can just summarize what you have said.
Dr. Jaya nyininka minna wolong ndella doko muneti ndella doko menti wolong ni sasata ni docteur prescription o safi ka kayto men safi boro bala ni anati ntelye nka menke folo nka jibele boro nying prescription o nying fani la courant yemem fo courant mento yo boro le safi natra wolong ya jibe boro nyin na dosage fanam boro nyin na sembo anyanda tala nyami will be nyanda tala je pharmacy le nanta make sure la ko will be correctly then na boro dada ay boro sikaya dila bar boro amanke diro dronte adum ni jamma fang la especially in Africa, Gambia precisely, ni dara dularo boro sangala dularo ni boro dila ka fa kilin somanda kilin wularo kilin so no o man correct inyanda fulo moyenne ebe boro ta kan dalilo men sasa men memba la ba be men jarala ni yo fa fana ya fa bari boro ni ata asike isi kundi min soto je asi lanjuro ke bala bari salon ko boro nyin anona tale bara sikati soto la fang bari indi even natra ye soto isalon ka ko boro nyin no kijo kanay fara So what is important, then ya fa for no boro ni nyanta tala nyame, and then also, you know, ya fa boro ni nyante na fala men, and you fa ya kumadi mal fa ya jikindi. Volunteer la do ko most important.
Thank you very much Dr. Jobate. Mbokk yi lu ma ko njëkk a laajte daal mooy liggéey pharmacist bi kan mooy pharmacist. Dr. Jobate wan nañu ne pharmacist bi moom daf day liggéey ci mbiri wér-gu-yaram te moom liggéeyam mooy ne su nekkee ne docteur bi bind na garab ne garab sàngam nga soxla ci moom la war a dem moom nag mooy seet ndax garab yooyu noonu nu ko docteur bi bindee si naka lañ ko war a jëlee ak yeneen garab yi nga xam ne moom la booleel ndax ànd na ndax àndut waaye nekkut ne joxe garab rek sax mooy seen liggéey mu ne sooy joxe garab boobu noonu war ngaa am waxtu boo xam ne yow pharmaciste bi nga toogaa ki nga xam ne moom ngaay jox garab bi ne ko nii ak nii ngaay jëlee garab bi lii moo tax ñu jox la garab bi soo jëlee garab bi dina garab boo jël nag am na yenn yoo xam ne daf dee di àndaa moom parce que looy def ci àdduna rek am na yoo xam ne dafa ànd ak moom yoo xam ne xëj na yow bugguloo woon sax mu àndaa moom waaye garab bi moo demee noonu mooy ne mun ngaa naan garab boo xam ne dafa wowal sa gémmiñ bi mun ngaa naan garab boo xam ne xëj na dina tax nga mel ni ku bugg a wëccu tuuti ak yooyu noonu yëpp moom moo la war a wan yooyu noonu yëpp nga xam ne sooy jël garab bi doo ragal parce que su nekkee ne dañ la jox garab bi nga dem nga jël nga gis loo xam ne xamuloo ko woon kon di nga ragal waaye su nekkee ne waxoon nañ la ne lii nii dafa ànd ak garab bi kon doo ragal dina la wax kon yooyu noonu yëpp naka la demee wax la garab bi lu tax ñu jox la ko wax la tamit garab bi kañ nga ko war a taxawal ak kañ nga ko war a ñàkk a taxawal yëpp moom daal ci liggéey ci seen liggéey la bokk waaye lu ma bëgg a laaj docteur Jatta mooy wax nañ loolu noonu ne loolu mooy liggéey bi we have talked about what the role of the pharmacist is. I'm going to come to that, Dr. Jobate, because really very, very important for us to be able to separate the duties of the doctor from the duties of the pharmacist and the duties of the pharmacist from the duties of the doctors so that people will understand more. But again, for people to understand who a pharmacist is, they should also understand their trajectory, their educational background, because pharmacists go through a lot of education. It is not the same direction as doctors, but it is the same duration almost, about 6 years you have to study in university. So it's a very long duration of time. There's a lot that you learn about. So it cannot only be dispensing. Because if it is only dispensing, then you can learn that in months, so to say. But this is a lot of knowledge that you have gathered, and we must make use of that knowledge. So tell us, how does somebody become a pharmacist? And what are the things, just in very small summary maybe of 1 or 2 minutes, what are the things that you go through to become a certified pharmacist?
Okay, thank you very much, Doctor. I think my boss here, Dr. Jobate, has given us a clue of what a pharmacist is supposed to be or do. The journey of a pharmacist is as difficult as any health professional, especially in relation to medicines. Pharmacy is, before you could do 4 years of studies, and still in other institutions you could do 4 years of studies, but where we studied and where Dr. Jobate studied, we did 6 years of studies. And these 6 years of studies take stages. And the first 2 years you might do just basic sciences, but as you move forward, then you dive into real pharmacy. That is when you learn about the drug itself, the pharmacology of the drug, how the drug affects the body, how the body affects the drugs. You need to understand that. That's what makes a pharmacist different from any other profession, because we need to understand what the drug does to the body and what body does to the drug. So in those processes, you don't just understand the drug, how the drug works, but you also need to see how in clinical practice, this drug, when they are given to patients, what will make the patient benefit from the drugs in terms of, like you said, if the patient is taking more than 1 or 2 drugs, now we want to look at what are the possible interactions the patients might, that might come out of the treatment. So these are the things that a pharmacist goes through, not just 1 day, 2 days, then you'll be able to dispense. It's beyond dispensation. You need to understand the drug itself. how the drugs works and how it affects the body and how the body affects the drugs. So these are the process of the
So in your journey, I am sure you learn about the human body, you learn about the anatomy of the body, you learn about the physiology of the body,
yes.
Then you learn about chemical natures of medications, how they interact in the body. So it's really a very long journey that you go through, and a very tedious one. I know that. Yes. In my school where I went to, we were allowed the same accommodation with the pharmacists, and we know what they went through, and they know what we've gone through. But you know, it's a very long journey, and the public has to know that,
of course,
so that we know the difference. Maybe in Mandinka, if you can just summarize what you said.
Coming Dr. Minyininka min wolong mino pharmacist ke mun joni leta pour que futa ke pharmacist. So natandala coming pharmacist afana mu professional mi alan ko karang paliatal amang ke sila don bi dorong yake pharmacist no. Pharmacist eke karang kaske kumas ke basic science or mi wala biology, science, chemistry ko wala kele ila starting the nibita kang is a boro fan karang boro walong chemical watin kementa so chemical lo ni nyanta ka understand le aki ila balo aka fek nyadi le ila balo fana ke chemical lo affect nyadi because nya boro ta ayenda tambile ida ko no le ke finti war wo process nyi ka finti balo kono abe mu stage le tara pharmacist nyanta ko be understand le so wala na pharmacist la karang wa manke comme finti mi alan ko bi se si do ko sama be ke la pharmacist no karang wo nyi a koliyata le and every stage ni kemen karang inyanta ka understand hadama dingo ballo fo inyanta ka understand le social inyanta ke understand mu sa si fal ke keten sa li ke nyaadi le sa le boro affect la nyaade boro be sa affect la pharmacie ko be karan so wala na pharmacist la do ko manke fente mi alan ko mo sinano le si pharmacie ko kono e boro di hani fo ya understand boro nyin ak hadama dungo na fa nyaadil an ballo fana boro fana affect la nyamin wala pharmacie ko la do ko leta bakel.
Thank you very much jërëgen jëf lu ma ko laaj moom mooy ne docteur Jobaate wax nañu lan mooy liggéeyi pharmaciste lan la war a def ma ne ko nag pour kooku égga foofu noonu mun a def liggéey boobu noonu si lan la war a jaar si jàngaam ak yooyu noonu so wan nañu ne ndekete jàngi pharmaciste tamit dafa mel ni rek jàngi docteur jànga bu métti la jànga bu yàgga la am na ñoo xam ne ci ñeneenti at la waaye am na ñuy bëri ñoo xam ne seen jànga balaañ ko mottali si juróom-benni at la gannaaw boo jeexalee ba high school di nga demaat yeneen juróom-benni at ci lu ñu ooyee university nga mun a génn ak degree boo xam ne dina wane ne yow pharmaciste nga ci diggante boobu nag loo dee di jànga mooy yarami nit ki naka la tëddee nga xam ne di nga mun a xam naka la yaram bi tëddee li nga xam ne dugg na si yaram bi naka la ko yaram bi dee di jëfandikoo ba pare tamit nga jànga yi nga xam ne moom la ñu ooyee garab naka lañ ko defalee naka la tëddee su duggee ci yaram bi naka la ko yaram bi di liggéeyee moom ci boppam ban liggéey la moo def ci yaram bi naka la dee génnee ci yaram bi loolu noonu yëpp jànga la boo xam ne jànga bu gudda la boo xam ne dinañ ko jànga balaa ñoo nekk pharmaciste kon mu mel ni docteur bi dina jànga lu yàgga pharmaciste bi dina jànga lu yàgga nurse bi dina jànga lu yàgga ñoom ñëpp nag ñu bokka nag liggéey képp ku nekk am ci place kon ku nekk nag sa war nañ la koo jox nga def ko noo ko war a defee pour ñu mun a toppatoo nit ki bu baax a baax loolu na ma ñëw ma ñëwaat ci Dr. Jobaate Dr. Jobaate you said something very important which is that the doctor sees the patient and recommends medications and that recommendation goes to the pharmacy. So what I understand from that is if Dr. Jah is sitting down here today in his office, a patient comes in and Dr. Jah says, okay, what is wrong with you? They explain and Dr. Jah gets a diagnosis. It is very wrong for Dr. Jah to turn around. He has his pharmacy behind him or his medication behind him, take the medication and give it to the patient. That will be very wrong, isn't it?
Yes,
because then Dr. Jah will not review those medications because he's written something. I'll tell you, just yesterday, I made a prescription in my hospital and I sent it to the pharmacist. And instead of twice a day prescription, which is what is usual for that medication, I had put 3 times a day medication. And I sent it to the pharmacy and the pharmacist calls me, Dr. Jah, I can see this prescription. You've written this. Is it what you mean? I say, oh, I'm so sorry. That is not what I meant. I meant BD. And if I were the one to give it to that patient, I might have made that mistake at that time. By giving that because the mistake is there. So it is wrong for me to do that. We start with that. What is then the thing that, so I have told you as a doctor what is wrong for me to do. For a pharmacist, on the other hand, if somebody comes to the pharmacy, what are the things that you would advise your junior colleague? I know that you teach in the university, you're a lecturer there, and you're teaching pharmacists, and you're even teaching some postgraduate pharmacists. So what are the things that you tell your colleagues that maybe they should not do from their side?
Okay, this is a very pertinent question that you ask, and we usually struggle with it. We tend to dip into each other's scope of practice, which is very wrong. As a pharmacist, we are not medical doctors, and I want public to understand that we don't diagnose. When a patient comes to you, that's not your responsibility to diagnose. But if they come in the community with minor illnesses like diarrhea, nausea, vomiting, headache, you should be able to triage that, at least at minimum, and just help them for preventive care. That's what we do in the community. But usually, if the condition is way beyond that, don't waste time. Send them to the hospital, to the doctor, for the doctor to diagnose them. Once they are diagnosed, like he said, he will write a prescription and then send it to the pharmacist for the pharmacist to review. And it's very pertinent that when the pharmacy reviews it, doctors are human beings. They are bound to make mistakes. I've seen that. I practice in America. I've seen that many times. So we just take the phone and then call the doctor, tell the doctor, hey, this prescription you wrote, like he said, the dosing regimen is not correct. Do you mean to do it this way? So oftentimes you save the doctor's life. He'll be so happy. He will say, okay, fine, because they are also on the pressure. And also what we do what is called substitution. If a doctor writes, for example, he writes prescription for an NSAID, like ibuprofen, for example. If we don't have it, or we don't have that strength, we can tell the doctor, we don't have it, but we have naproxen. They are interchangeable, so you should be able to dispense that. So we collaborate with the doctors, but we have to stay in our lane.
So just to clear this part, it means that the doctor, if a patient goes to a doctor, because what we want in this program is really to educate the masses who don't really understand how the medical practice works. So if a patient goes to a doctor who is a doctor, and the doctor sees them, diagnoses them, and he himself takes medications and gives them, they should have a question.
Exactly.
They should be able to question that.
Exactly.
Okay, and because where did you take this medication? How did you store this medication? Exactly. Because that's also part of your job, to know how to store the medication, where to store the medication. So the doctor can't do that. Also, in the same hand, what you're telling me also is that they can't go to the pharmacist and tell the pharmacist, I have a headache, so what are you going to do for me? I understand what you have said, which I know is done everywhere in the world. You can go to a pharmacy and talk about your complaints, and they can give you mostly what we call over-the-counter medications. These are medications that are safe enough to give, that pharmacists can give to the patients to alleviate their symptoms.
Exactly.
So that, in a day, 2 days, if it doesn't get better, then now they can go to the doctor, to look for a doctor.
Very good.
To
good
see
practice.
whether things. That's a good practice,
Very
and that
good.
I think that is what we have to tell our people all the time, so that the doctors don't go beyond what they're supposed to do. The pharmacists don't go beyond what they're supposed to do, and only that way, then we can give safe medications or safe treatment to our patients. So I'm very happy that you talked about that. Maybe if you can just go through all that in Mandinka, what I have said, what you have said, so that as a summary.
Dr. Jaya Nyininka men dron wolong coming doctor or physician melbe lopitano to in pharmacist itella doku mbe bondi la nyokono nyaadile nkamel fu mole dron physician mel doctorol melbe lopitano to wolle responsible ta kamo wiste ni sasa re nyanta tale tella ya yi wiste tella doko molete yi wiste ye jibe ni ye diamu ye samba lab ye tesnyol ke yol be kafu nyoma ya fo nyum kuran karle be la sai sina boro safe ni boro safe den ya natin telye bari intel wistero mankentel la do ko wote ni dara do ni wister be wister do ni pharmacist yake o man correct. You know, the only time pharmacist be makoela ayake wala nin doctor o bistero ka ko nyin sasa le bela then doctor o sa fo ta pharmacist ya then asiboro dila then after that isimuru no pharmacist ya le kelo kuran because already a diagnosed is called continuity of care bari intel kamen ke dro nga boro dila nga fo boro be nafala nyame minyanta kala and other things mol nyanta wala kala so it's very important mo be load lalong. But Dr. Jah, just to add on to one thing, pharmacists run what is called specialty clinics, you know, like diabetes, hypertension, dyslipidemia, anemia, and even heart failure. But in these clinics, for patients to enroll in there, for a pharmacist to continue to care for them, the doctor must have diagnosed them. And the thing is, doctors don't have time. We have to give them time to diagnose, catch them in the right time. So once they are diagnosed, they have this condition, then doctor doesn't need to be managed, he doesn't have time.
Sure.
So the pharmacist can take care of that, but you know, he had to put the doctor in the loop.
Of course.
You know, to make sure if conditions get exacerbated or worse, then they need to be referred to the doctor because that's beyond you. Those are very, very, very important.
Thank you very much. I think you can say that also in Mandinka. I don't know whether you've captured that point
No,
that you've just given me. Maybe you can capture that point in Mandinka also, and then I can capture it in Wolof.
Nkamem fanam fo wolong pharmacist fanang itel ka ekalo jaral bunda not only ka boro di but jaral sasa dol bije ning ni doctor ya fo ko nyine soto comme sukur kurang yele sia yele manko o heart failure ni o soto doctor o fan ye you know I evaluate I check ako nyine be la boro safa samba doctor pharmacist ya sa pharmacist fana ya atesi continue kelo sasa nyin topoto because doctor o man time soto and usually ni ko ibila doctor ya luolong wala wato wadi one purukaje do ko wala ni aje fana ci time sot la purina idea but pharmacist o vitala drong ibitala yale ayela sukuro jibe ay yelo jibe ku dol ke dena fo ko be continue la boro nyintala hani ingeno koto anin the liver is wol tesnyol be ke de ni aje ko wol imam betaya isaje kadu boro le ko ultinya so natre ko borsi falta isa fo ko manjare nyinta ngabondi puruke ila liver nying protect and also ila keno ko and so bari nin sa fa wajabita farlo long ite pharmacist ye patient no nying refer back to the doctor ya fa ko sa nyin sang a wajabita le ita jibe la ko tenke ba nga jibe ba mako eno la nyam.
Thank you very much, Dr. Jobate. I think that's very clear. Dr. Jobate, yokkana rek si luñ waxoon léegi nii ne lu dee xew mooy ne docteur bi moom su bindee garab bi mu yónnee ko ci pharmacie bi moom na gis garab yi jox ko naka la ko war a joxee ki nga xam ne moo feebar waaye am na ay feebar yoo xam ne dafa soxla continuer di toppatoo nit ki te loolu noonu docteur bi du ko mën a def gannaaw docteur bi dem na ba gis nit ki ba tesal ko def yëpp ne ko yow da nga am diabète garab sangam laa jox nga jël mu jox la prescription mu yóbbu la ci pharmacie bi soo demee ci pharmaciste bi dañ dee di am lu ñu ooyee specialist clinique yoo xam ne ñoom dañ dee continuer di la faj mooy ne weer bu nekk wala ñaari weer yu nekk war ngaa dem ñu seet sa sukar bi fan la toolu ñu doolil la sa garab yi su nekkee garab yi dañ ko war a yokka tuuti ñu yokka tuuti su nekkee dañ war a wàññi tuuti ñu wàññi tuuti loolu yëpp pharmaciste bi daf ko dee def waaye tamit daf ko dee def ci collaboration moom mu liggéey ak docteur bi tam nga xam ne loo xam ne rek changé na rek dina ci waxtaana docteur bi ne docteur bi lii de xaw naa changé si waa ji bugga nañ a change lii nii ñu waxtaan ci ñu def ko loolu dina ma indi ci beneen topic mooy what we talk about maybe what we will do now is we will open the lines because sometimes our viewers can direct the discussion very well. So we'll open the lines on 505050. The time goes very fast. We're already more than 20 minutes or 30 minutes in the program. 5050 for anybody who wants to be part of the program. Once you call, we're going to pause whatever we're saying, and then we're going to concentrate on you. But we'll get the technical team to ask them first what they're going to ask, so that we know that it's part of this program before we go on, so that we don't have some delay and say. So 5050 there are some numbers also on the screen for you to call if you want to call those numbers. So mbokk yi léegi ubbi nañ ci line yi ci 5050 balaa ñoo laaj Dr. Jatta beneen laajte bi, waaye képp koo xam ne am na laajte wala bëgg naa dugg ci programme bi, ñu ñaan ko rek mu laajte si lu ñoo waxtaanee tey, ñu gën see mun a dugg, parce que gan yi ni am ñu mel nii di ñëw fii nii du dee yomba, du bés bu nekk lañ ko dee am. So nañ leen laaj ñoom lan lañ leen war a laaj nga xam ne dinañ ñu ko ansal. So 5050 if you can just say that message to the viewers in Mandinka, that they can now call on 5050.
Mbaɗigol coming Dr. Dia kemin foten sayne layno bunda yelele pour momo kuma kan soto na trade programme o jibe kan ise kumandiro keno 5050505 pour isele kuma kan kanyinen ka, because mol be sire njan min yalan ko na tayela kuma kan wonen a funkata jang coming pharmacy wala relationship insa ajabi nole so Dr. Kwalaf.
Thank you very much. Dr. Jobate has brought in very important aspects, which is the collaboration between the different fields to make the patient better.
Yes.
But the most important thing in that, in my view, is what he has mentioned, is the communication. What is your assessment? You're working with the government of the communication between the pharmacists and the doctors in this country. How is the communication going? Is it really very, are we using it to the maximum?
Thank you very much, Doctor. This is a tricky question. But what I could say is I've seen a very much difference between when we started practicing and now. I remember when I first started at FSTH, where I was practicing, the first time I was in a ward, I was asked, who are you? It was a weird question because I was not expected to be there. And I know Jeta Ibrahim, he's also a pharmacist working at FSTH. When he started, he must have encountered such kind of difficulties, because this is not something.
We always promise our viewers that we will interrupt when we have a call. So we have a call. Hello, caller.
Hello, assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
Nangen defo.
Jàmm rek sant Yàlla.
Program bi neex na, is so educative. Li ma bëggoon a laajte mooy. There was a time dama demoon ci pharmacie. Bi ma demee foofu noonu maa ngi soxloon garab pour suma doom. Mu ngi amoon ay infection sota, waaye bi ma lee gars yi dañ ma bindal prescription. dañ ko lii ñu laajte ñu def consultation bi ñu bindal ko prescription, ndax loolu jaadu na ci liggéey pharmacie.
Okay, baax na. So maybe dinaa bàyyi Dr. Jobate answer loolu balaa ñoo duggaati ci lii. So lu mu wax mooy ne dem na ci pharmacie, doomam baa ngi am problème, gars yi bindal nañ ko prescription, gars yi jox nañ ko garab bi. In English, what he is asking is that he has gone with his child to the pharmacy, and in the pharmacy he was a prescription was written and he was given the medication. Was that a right practice?
Well, like I said earlier, as far as diagnosis is concerned, that's the responsibility of a physician. But again, in the beginning, I said we are right in the community. We are very accessible. So when they come with emergencies like that, those are minor cases. The pharmacists can take them inside and triage them. Look at, at least they should be able to take vitals, blood pressure, temperature, respiratory rate, and interview the parent. So if it directs toward, if the evaluation is pointing at possible infection, so you can just give something easily, but don't go too far. Then you tell them to use it until the next day. If no improvement, then you tell them to come back. Then they come back, you refer them immediately. But you should not be doing a lot of things. But at that point, it's very important to help the child, to relieve that pain, to make them feel comfortable. That's what we, the pharmacists should do. Yes. But to go into detail, you need to refer.
Yes. So I understand that, and we have to make it very clear to our viewers that yes, with common ailments, even at home, when I'm at home, I can sit down there, I have a headache, and I say, let me take paracetamol first. If it doesn't get better, I will then go and see somebody for help. And it's the same thing with the community pharmacy.
Exactly.
When you go to the community pharmacy, you say, well, my child has a headache or has a fever, then they can look at it and see. They have in their training, you have in your training, you've gone to the anatomy and physiology, to be able to recognize what is serious, what is not serious, and then say that this is not very serious, I think, and I'm going to give you this. But I think in the communication, the most important is what you have said, and we have to stress it here, is that if it doesn't get better within a day or two, go and see a doctor. I think that is what the communication be from any pharmacist or any person dispensing medications for common things is, if it is not getting better within a day or two, go and look for help. Yes.
And again, to put it back to the patients, when they come, it's such that they want you to do something for them.
Yes.
It's like you have a magnetic field in you, then you would just throw it at them, and their sickness would just come out. They would insist you have to give them something. So that's another thing.
I think that's another thing we can delve into. Time is going very fast, but if we can say what we have said in Mandinka and Wolof now, just the question, the patient's, the person's question, and what we have answered it.
Okay. Comme ñinin kar la dole telephone ke ay ñinin karo ke akafu ko ning ading sasa tale no ay asam pharmacy to then wala ya samba kono to ya wiste ye prescription no safaye then ya diala akofo nyanta kelale. Nkai well a depend la anata nyame because sasa nin sasa bele te ke mira men na wolong ay boy bala so ni nata ba until be community le to until mo si tamano le yen duntel kan para doctor o pour bo jele ba arrange le pour kata loptan so ni nata until kan at least ni follow tan kan nsi dundi kono to ngi nyininka ni ngi kachandi nga dindum fanga jibe asike sasa mo boro bentel bullen sadino la le at least I fisia bari mba fule ne bunyum boro dile la pour ya dia la telekilin tilfula na man kende ya yemuru nan ngeri fatu e doctor o yeta loptano to pour wolsi jara so ngamira wol usually wol man jawya bari kanata dorong e man kende kamuru wod lato ko tenke wati be murula be borol dile la o man bete mo man nyanokel ni dara je sinya kili man kende ya adin courant nyin aka wajabi nyanta make sure la le yeta doctor o.
Thank you very much mbokk yi borom laajte bi ñu ngi ko gërëm bu baax a baax ci laajte bi lu ñu wax rek mooy dafa des ci feebar bi naka la demee am na feebar yu bëri yoo xam ne mooy feebar yi comme yu gaaw yi nga xam ne mun nañ koo faj ci lu gaaw a gaaw yooyu noonu yëpp soo demee ci pharmacie bi mun na laa xool gis ne tas ci jàngaam bokk na ci loolu noonu gis ne lii nii nekkut loo xam ne jar na sax dem gisi docteur dinañ la jox paracétamol mu wér wala dinañ la jox dara loo xam ne yaa ngi am biir bu daw bi taxaw yooyu yëpp mun nañ koo def waaye nag lu gën a important si lu ñoo def noonu mooy suñ la joxee garab bi ñu ne la jëlal garab bi nii parce que ñun defuñ diagnosis ñun dañ la xool rek ñu foog ne lii la ñu jox la garab bi su nekkee ne tane na baax na su tanewut nga ñëwaati ñu yóbbu la ci docteur wala nga dem ci lopitaan ñu seet la foog naa loolu lu important la waaye we need to complete what we were talking about the communication between doctors and pharmacists.
Yes.
And you were talking about your hospital experience and Dr. Jaita. Mr. Jaita.
Yes. So like I said, initially we had a bit of resistance in terms of like us moving into the territory of clinicians because pharmacists, here, before in other countries, it is not the pharmacists will join the clinicians in their ward rounds and recommends some form of clinic drugs for a particular patient or withdrawal or addition of a particular drugs. So when we started, we get a bit of resistance, but over time, we built that kind of rapport, that kind of relationship with the clinicians. In fact, we get calls sometimes that we have this situation, what would you recommend? And this is based on building a relationship over a period of time. So I can happily say that the relationship between the doctors and pharmacists have improved.
And that's what we want. We want more improvement so that we can help the patient.
Of course.
So mbokk yi maybe in Mandinka first before I say it in Wolof.
Yes. So doctor jinin karo min ko wolon coming to pharmacy sol and in doctor sol na diamo na do ko nyokan abe nyaadi le coming communication no ntol da mangol tema coming nata ndala coming nya kabin tol nata nte pareta na studies la nata jang na do fanantara jan nkafu nyoma na keba ibrahima jete
we have another caller.
Okay.
Hello.
Hello, doctor.
Yes, sir.
Nare.
Jamarek.
Nago good evening.
Jamarek, alhamdulillah.
You are in program in Nagol. So one lima buga wa mai. Comme ñu bari so gisee ñu min comme pharmacie ni. Comme so feebaree nga dem l'hôpital bi ni. Nga wax leen seen feebar bi ñoom dañ la dee bindal garab dañ la dee teg ñu bindal la garab ñu ne demal ci pharmacie. Léegi tax na ñu bari suñ amee problème ñoom duñ dee xelaat ma dem loolu.
waaw dañ bëgg a bypass boobu noonu.
ma dem ci pharmacie.
ma dem rek street gannaaw foofu laay mujjee kay xaaral ma dem waaw.
demal ci pharmacie. moo tax léegi tax na ñu bari dafa suñu amee feebar rek duñ dee xelaat dem lopitaan te ñu naan ne xaaral ma dem ci pharmacie.
waaw because foofu laay mujjee. waaye foofu la mistake bi nekk nag. foofu la mistake bi nekk foog naa foofu fu loolu tax ñuy def programme bi nii. waaw foofu mooy problème bi.
ñoom dañoo dem direct ci
waaw because ñu ngi bugg a lu gaaw.
waaw
because ñu ngi bugg a lu gaaw waaye foofu la mistake bi nekk parce que dem lopitaan bi ñu jox la prescription nga dem ci pharmacie bi nga jëli sa garab bi loolu mooy yoon bu correct bi. waaw nit yi yeneen nit yi mën a dugga waaw so we will come to that let us complete your narrative first. Yes.
So coming aya fu nyame tol pharmacy so nin doctorol na doku nyokan anina diamo na ke nyomo yo be nyadile kaya ko coming kabintol nata follow ke practice as a pharmacist na communication nin doctor sol among amanta fota dular mi ko lafta fota dam bare coming ya jele coming ndefe coming be dunkan dulato mi yalon ko muy to la reality because pharmacy sol bu ko tanu wodo ko ni doctor kariya ke borol ka fo go
we have only 5 minutes so we'll need to summarize quickly this part so that we can go to something else.
So namin fay coming sign doctor so alhamdulillah na do kunyo kan kenyo consult le ke sile ken kumandi nyimboro ali ñu soto bang ngi peso na ñu sota malo sebum borle recommend things like that wo do kunyo ya alhamdulillah proof the back and dama temal.
Thank you very much. Luma ko laajoon rek mooy diggante docteur yi ak pharmaciste yi naka la waxtaan bi naka lañ dee jokkoo yee daal naka la jokkoo bi mel mu ne si njëlbeen bi jokkoo bi jafe woon na lool parce que kenn xamutoon fan nga war a taxaw fan la keneen di dem waaye léegi nii mu ne jokkoo bi mu ngi gën a baax nit yaa ngi gën a xamante ci lopitaan bi sax léegi nii pharmaciste yi su ñoo faj garab bi dem ci ward round dañ ci dee di bokkaale docteur yi di laajte pharmaciste yi garab bi nii lañ bëgg a yokka naka la ñoo def naka lañ ko war a defee ak yooyu noonu mu nekk daal jokkoo boo xam ne jokkoo bu am la njëriñ ci ñëpp loolu noonu mu nekk lu neex a dégg ki nii laajte nag léegi nii loolu noonu mooy ki nga xam ne rek parce que kenn bëggut a dem lopitaan parce que dañ dee di waste time dañ foog ne dañoo waste xaalis so moo tax ñëpp daal dañ bëgg a dem rek straight ci pharmacie bi te yow noo ko waxee I think what Dr. Jobate said is really very important that some of the minor ailments you can go to a pharmacy. It's just like going to a fast food.
Exactly.
But you cannot go to a fast food every day. It is not going to be healthy for you. So you know when you go to the fast food to take a burger and you do that every day, you're going to harm yourself. So you go for the minor things that you need to deal with, and then they can deal with it. And if it is not going well, quickly go to the doctor. But I want to now go on to your to the event that is coming on the 25th. Is there anything the public should expect? Is there any participation or what is going to happen on that day?
Okay, well, that is very important. On the 25th, which is September 25th, on a Wednesday at about 11 o'clock, we are converging at the monument in Westfield. That's where the event is going to take place, and there would be free screening. We would do free diabetes blood sugar. We would do blood pressure testing, anemia, malaria, and more importantly, we will be counseling as well and educating the public. So the public is highly encouraged, to come and then seize this opportunity to have screening done, to know where you stand. Then you can take it to your doctor to discuss it with your doctor.
So at 11 o'clock on Wednesday,
yes,
at the monument, in Mandinka Place.
Okay. Nkamen fo yalong me mol si jang wolong puruka ntella do fo but also nga jura role soto arabalong ning alasonta 11 o'clock September 25th wolong arabote menkana. So at the monument to Westfield abestalla je 11 o'clock. So be free testing kelale nin sukuru courant be men sina nin tension be la hypertension ni yele manko le be la sina nan ani malaria fanan boke la le foka pare be na lafta faal nin borol fanan sina ba la borol jibela to do what is called medication review and reconciliation pour ka make sure ko borol e ka borol melta is the right medicine imantare duplicate kan. So okay. I'll be invited.
Thank you very much, Dr. Jobata. I think we have only 2 minutes. I'll take about 30 seconds to summarize what he has said now. Then we'll give 30 seconds to any one of you to say your last words before we go. Mbokk yi lu Dr. Jobata doon wax léegi rek mooy ne àllarba bi di ñëw boori fukki waxtu ak benn ci monument bi fii nii ci Westfield dinañ am foofu noonu benn programme boo xam ne ñoom dinañ fa nekka dinañ def ay gëstu ci nit yi képp koo xam ne bugga ngaa gëstu ndax yaa ngi am jabet ndax am loo jabet soo demee foofu dinañ la seetal képp koo xam ne bugga ngaa gëstu ndax yaa ngi am tension ndax am loo tension soo demee nañ la ko defal ñi nga xam ne dañ ñàkk deret ak képp koo xam ne tamit yaa ngi am ay garab yoo xam ne da nga ko dee jël mooy ki nga xam ne dafa am jabet bés bu nekk mu ngay jël garab wala tension wala yooyu noonu nga bugga nga ñëw ci ñoom ñu seetal la garab yooyu jël yëpp ak naka nga ko war a jëlee ndax ànd nañ ndax ànduñ loolu noonu yëpp ñoom dinañ la defal loolu noonu te duñ jël butuut ci yow ci loolu noonu kon loolu noonu lu ama am important la maa ngi ñaax ñëpp ñu dem man mi sax su ma amee time dinaa fa jaar seet naka la mbir yi demee waaye Jobaate maybe we have your last words first then your last word then we can go. We have only 1 minute to go now.
Okay. Thank you very much, Doctor. I want to thank you and the QTV for giving us this opportunity, but I want to talk to the Gambian youths, young ones in specifically. Pharmacy is a profession that people need to come into. If you look at the Gambian context, we are very few in number. So for us to have a very big impact into the community, we need to have that number. So we encourage the young ones to look into the pharmaceutical profession as something to venture into so that we can improve the Gambian health sector.
Quickly, if you say, well, that I think that is good for English speakers because they are the ones who are getting educated. So your last...
Quickly, I want to appeal to the public. It's very important that they be very careful where they go get their prescriptions, particularly these corner stores, these drugstores. I'm not saying all drugstores, but certain drugstores are there. They are not licensed by Pharmacy Council or MCA. So you need to be very careful. And some people have drugstores in their houses. Don't go there. That's not good. Because according to Institute for Safe Medication practices.
It's exactly time. Maybe just a last word now.
Okay. So just to avoid adverse drug reaction, just be careful where you go.
Thank you very much. I think we have been alerted that the news is coming up next and we have to stop almost immediately. But it's been a very wonderful discussion with both of you, and I promise that we must sit down and talk more about pharmacy so that people understand what is the dynamics between the two. But we thank you very much. Jërëjëf Jeff ci seen déglu bi mool bi kontaan la. Thank you very much to the technical team. Till next week. This was the program today.
Thank you so much.